Hi, so today I'll be talking about hepatitis B. According to the CDC, as of 2022, 296 million people in the world are infected with hepatitis B, and of that population, over 6 million are children under the age of 5. So misinformation, the lack of resources, and the lack of awareness of hepatitis B has helped fuel this disease into becoming a global health problem. So today, first, I'll be talking about what hepatitis B is and how it is spread. Second, who is at risk. And third, some prevention methods and treatment options. These past few weeks, I've conducted research over this disease, and I feel with minority communities being disproportionately affected, it is important that we share as much information as possible to potentially save lives. So now that I've discussed what I'll be talking about today, I'll now move on to my first main point. So the CDC defines hepatitis B as a vaccine-preventable liver disease caused by the hepatitis B virus, also known as HBV. According to Acute Hepatitis B, an unusual follow-up in a 16-year-old, ran by Bienkowski, Kolesik, Pluta, et al. In 2021, there are two versions of hepatitis B. There's the acute infection, and then there's the chronic infection. The chronic infection is the one that has a higher mortality rate due to it causing liver cirrhosis, which is the scarring of the liver, and it can also lead to liver cancer. In addition, there are multiple ways that hepatitis B can be spread. According to the U.S. Department of Health and Human Services, hepatitis B is spread from mother to child during birth, sex, and drug injective materials. According to the World Health Organization, for mothers who have a high viral load of HBV, their child is at risk of having hepatitis B as well. There's a 70 to 90% range. And according to the Common Concerns and Barriers to Care in the Life Experience of Individuals with Hepatitis B, written by Freeland, Farrell, Kenmar, et al. In 2021, there are a lot of misconceptions about this disease as well. A lot of people think that you can get it from kissing, from hugging, and sharing food, which are all false. So now that I've discussed what hepatitis B is and how it is spread, I'll now go into who is at risk. So since hepatitis B is not a genetic disease, that means there are a lot of people who may be able to get this disease. It depends on where a person lives, their occupation, and their lifestyle. So according to prevalence and factors associated with hepatitis B and D infections among sex workers in Chiang Mai, Thailand, run by Hong Yes, Kamadwang, and Sefron in 2021. Since sex workers typically have multiple sex partners, they are more susceptible to getting hepatitis B. And of the sex workers in Chiang Mai, Thailand, HBV was found in 11.4% of them. Healthcare workers are also likely to get this disease as well. According to Healthcare Workers and Hepatitis B Prevention, written by Kay, Shanong, and Nair in 2022, 40 to 65% of healthcare workers in India were found with hepatitis B. Also, an interesting fact is that the Asian population makes up a majority of hepatitis B cases in the United States. So according to the CDC, although Asians only make up 5% of the US population, they make up 58% of the people who are infected with chronic hepatitis B. In addition, according to hepatitis B screening and awareness in the Milwaukee Hmong community, the Hmong have, written by Hyun, Nguyen, and Wang in 2021, the Hmong have one of the highest rates of chronic HBV infections, up to 20%. So now that I've discussed who is at risk, I'll now go into some prevention and treatment options. According to the CDC, 40.3% of adults ranging from the age of 19 to 49 have been vaccinated. However, that drastically decreases to 19.1% for those who are older than 50. But according to the World Health Organization, as of 2022, the global coverage is around 80%. Some treatment options listed according to the Mayo Clinic. There are antiviral medications, interferon injections, and liver transplants for those who have chronic hepatitis B. But as we all know, if you're on the organ list, that doesn't necessarily mean that you will receive like a liver. It may take time, and for some of those, that time is very costly. So in conclusion, prevention and treatment options are available, but many people are still dying. Misinformation, lack of resources, and awareness have fueled hepatitis B into becoming a global health problem. And today I talked about what hepatitis B was and how it is spread. Secondly, who is at risk. And lastly, some prevention and treatment options. And I just want to end with people with hepatitis B are people too, and they should be treated as such. This disease is very often stigmatized, and I feel that we should try to see those people affected in a brighter light and spread as much awareness about the disease, because that can save lives. So thank you. And those are my references.